Okay, well, this is going to be one of our first series where we actually would like to interview our patients, Ms. Ortiz here. We'd really like to thank you so much for actually taking some time out from your very busy schedule. She is obviously one of our colleagues. I won't tell you where, but she is absolutely essential for making this hospital run, okay? That is for sure. I truly feel that one of the problems that we have, especially in the field of obesity, is we do a lot of research. There's a lot of debate among the clinicians, but we don't translate that to our patients. Our patients get more confused by the amount of research that's actually published. And so my goal is to try and simplify that. How can you apply the research that we're performing and doing in your day-to-day activity? So without further ado, I'd like to introduce to you Ms. Ortiz. And Ms. Ortiz, the whole goal of this is to tell us your perspective, really a patient's perspective, understanding about health concerns, about why you chose a program, et cetera, et cetera. So I'm going to start and say, would you introduce yourself to us so everybody gets to know you?
Okay, good afternoon. My name is Sandra.
Okay.
And I work here. I'm a long-term employee at Memorial Hospital in Jacksonville.
Uh-huh.
And through the program, I have met Dr. Abbas.
Okay.
So I am so happy that I have come across him. And he introduced me to the bariatric and the gastric bypass.
Okay, well,
Gastric sleeve.
That's exactly, no, thank you. So tell me this, recently we actually did a short clip talking about New Year's resolutions. Everybody has one, and 70% or more people, including myself, I'm sure a lot of people here, have what we call health-related specific New Year's resolutions. What have these been for you?
Okay, so for me, has always been not only the weight, but one of my goals was try to stay away from my medications. My medications has been my long goal.
Okay.
Especially diabetes medication, because I've heard so many things, and I always told my mother used to tell me, my feet and the limbs, the loosening of the limbs due to high diabetes medication or high blood pressure.
Right.
So that's been always my fear.
Right, and that is one of the things that I think people minimize is, of course, obesity is a complex disease, and specifically in patients who have other comorbidities. And I think as Sandra said here, diabetes is a main problem there, and obesity will most certainly contribute to diabetes, and it will most certainly lead to uncontrolled blood sugars, which should lead to further complications, as you described to, wounds not healing, eye problem, vision problems. And one of the things is, once you start on medication, we don't have right now a way of curing diabetes, except for metabolic surgery. That is actually the only way that we can potentially cure diabetes. So tell me, have you always struggled with your weight, or?
Yes, I have. Ever since, I would say, I always call it baby fat. And so I'm still having the baby almost. He's almost 40 years old.
Okay, yeah.
So ever since, I became pregnant and all that, I still have that weight problem, and I have not been able to get off.
Right.
So I became diabetes after that.
Okay, so that's not an uncommon story that we hear. So what has your journey been through this whole thing? I know you've had you tried, is it the gastric adjustable band?
Yes,
to
and
try and
it's
help?
been an up and down. It's yo-yo, up and down,
Yes.
up and down. Lose weight, lose 20, gain 40.
Okay, okay. So again, not an unusual thing. The problem is, and we will hopefully explain it in some future videos. The yo-yo dieting is a very common thing, and unfortunately what happens is people, when they diet or crash diet, they lose 20 pounds, but then they gain 25 pounds back. It's because your body is fighting you. And so, and any time you pick a battle with your body and your physiology, you will lose. Okay, let me tell you that. It's a simple physiology. So what has been, let me tell you this now, since you've undergone metabolic surgery, what has been your experience with our program? And most importantly, what would you tell patients, specifically those who struggle with weight, but are almost sometimes ashamed of asking for expert, opinion? And the way I see myself and my department here, with my colleagues, Jenny and Cynthia, is we are actually obesity experts. As in, just like you go to your cardiologist for hypertension, we can help you. Not everybody needs surgery necessarily. We can, devise a plan for you with medication if need be. It's an escalating management. But What would you tell these patients?
Well, I'm going to tell this patient that if you truly need it, do not be afraid. Do not be afraid. Dr. Abbas is the best doctor around, number one. And do not be afraid. It's a struggle. It's going to be a battle. You are not going to be able to eat that juicy steak any longer. You're going to have to cut it in little pieces. And by the time you get finished cutting, you might not be able to eat the whole steak. But, you know, personally, my sugar has gone down tremendous amount. My high blood pressures have gone down. I have been taking out of lots of medications, and that's my goal.
That's fantastic. You know, I think that's a great success story here, and we hear this, you know, all the time. Let me say this. You know, you are a true inspiration to all of my team, our patients, and most certainly to somebody like myself who does this for a living. So I get a tremendous joy when I see, you know, your medications have been cut off and you're just feeling better, having more energy. And as you said, this is a journey. So whoever or whatever program, that is the most important thing that you pick. Make sure that they have a good support group.
Exactly.
Mr. Ortiz, any final words that you have for us, other than the great advertising you gave?
Well, you know, you have to commit yourself to it.
Yes.
You have to commit yourself. It's not going to happen overnight.
Yes.
You're going to have your struggles. You're going to have your fears.
Yes.
Okay. Everything. It's not going to come overnight. You will have all that. But eventually it will pay it off.
I think those are great words, and it truly describes the journey. Well, thank you very much again.
You.
And I know I bump into you multiple times a day because you keep doing your walking up and down.
Yes, lots of walking.
Okay, thank you very much again.
You're
Thank
welcome.
you.